question. So in the Northeast, our season's starting. A lot of districts are focusing right now on surveillance. A big concern throughout the Northeast is West Nile virus, Eastern equine encephalitis, and then you always have to worry about new diseases coming in when we're seeing expanded species range. So a lot of districts are really right now focusing on monitoring for these disease harboring mosquitoes and then taking care of monitoring their positive pools. So I think throughout, mosquito control in general across the country, Northeast is just the same. They focus on having a healthy chemical rotation. We don't want to be using one product more than another, and we don't want to be using one product only in our control toolbox. We want to have as many different tools in our toolbox to use to help them fight different mosquito species, the larvae, the adults. So as long as programs are sticking with their chemical rotations, I think everyone's in good shape. So on the vibration side, something that's been starting to break out a little more in the Northeast is the use of drones. So drones are a very cool piece of equipment that are able to help a lot of programs. Both you have drones for mapping and monitoring, so doing things like GIS, and then you have control drones that they're really able to get into those areas that are more difficult to get to by foot or more difficult to get to by car. So drones have been a very upcoming topic in the Northeast, on top of our normal equipment like our ULVs, our backpack sprayers. So drones are the next big hot thing in the Northeast. So in our territory of the Northeast, drones are starting to break ground. There's some states that are using them, like New Jersey has a few drones, and they are starting to really help programs with these areas that are very difficult to treat. They're difficult to access. They're difficult to get vehicles in, have people carry backpack sprays. It would be very cumbersome. So drones are a very big supplemental tool in these areas that are hard to reach, but they're problem hotspots with mosquito larvae. So I would say ahead of our season coming up, West Nile virus is always a very big concern, as well as Eastern equine encephalitis. So what our mosquito control programs are working on is they do surveillance. So they're going out, they're looking for these mosquitoes that can potentially bear these diseases. They work with public health officials to test these samples and to look for disease positives in the mosquitoes. And then if they do find positives, they make control efforts based on that. So we always want to find our positive mosquitoes first to try to prevent any human cases, and then they make responses based on that. I think in the Northeast right now, we're kind of at a hub of we have invasive species starting to pop up here and there. A few years ago, we had a new tick species. We're also seeing some mosquito species have expanded ranges. So mosquito control professionals in the Northeast are constantly on the monitor for different vector-borne diseases and new vectors that may pop up in the area. And this is all done through different surveillance methods. So I think in the Northeast, one of our concerns is monitoring for potential invasive species.